Welcome to the Limitless Ladies Network podcast, where we are limitless in sharing lessons to advocate and drive insightful, empathetic self care. The Limitless Ladies Network is dedicated to nourishing minds, educating on self care, and facilitating transformative experiences. Our mission is to guide women to age with grace, cultivate good health, and build meaningful connections to bring happiness into their lives. We strive to empower the ladies of the community so they may successfully advocate for themselves and embrace a journey of holistic well being. Please note that the information and opinions shared on this podcast are for educational purposes only and are not intended in any way to be used as medical advice. Please seek a medical professional for any health related matters, and always refer to our full disclosure in our show notes. Hello, and welcome to today's episode. I'm Tammy Dungan, your host, and I am so happy to have with me today Dr. Markyia Nichols to talk to us about some functional medicine approaches for women's wellness. Welcome, Markiya.
Well, thank you so much. I'm so happy to be here. I know we've been planning this for a while, so happy to have the conversation.
Yeah, me too. So tell us a little bit about yourself and your background with functional medicine.
Sure, sure. Yeah, it's an interesting story. I started out in OBGYN in traditional medicine. So I've been practicing now for over 20 years. And in OBGYN, honestly, I loved it. I loved my women, I love my babies, I love doing the deliveries, the kind of being on the go, and it was fast paced. I loved it, but my body didn't love it.
Mm.
And what I noticed very early in my career is that I would have women come into the office, and I've always had very strong intuition when it comes to the body and with people. And they would come into my office and they would say, Dr. Kyia or Dr. Nichols. I'm Dr. Markyia Nichols, but I go by Dr. Kyia now. And they would say, I think I have a thyroid issue. I'm gaining weight and I'm tired and my hair is falling out. And I would talk to them and I knew they had a thyroid issue too, just by talking to them. And so we would say, okay, well, let's do the labs. And inevitably the labs would come back as normal.
Hmm.
And it was the hardest discussion, sitting across from them and saying, I'm sorry, it says you're normal, and
Right.
having very limited tools like in my tool chest. It was okay, well, let's give you the antidepressant for your mood, and let's give you, the birth control pill to control this. And inevitably they would come back, year after year with more and more symptoms that we had to put another pill on. And it was so frustrating to me. I knew that there was like some missing piece. And ultimately, after this was going on for a couple of years, I became the patient.
Oh,
So, after the runaround and, eating on the go, eating poorly, just being stressed out, I started having those same symptoms and I did my testing and it was normal.
mm.
And I refused to start myself on those same medications that I was actually prescribing to people. And that was way out of integrity to me. It's like, what am I doing here? So I almost quit medicine. I almost retired. I was only like 4 or 5 years in. And through a number of synchronicities, I actually found a colleague who suggested that I look into functional medicine or root cause medicine. And I went to an initial conference and then I went to do the fellowship training and I actually fell in love with medicine again. And I realized it was like all the things I was telling people you'd have to be on medication for life or you'd have to manage, like they were getting reversed within a couple of months.
It's
And
amazing,
I
right?
know,
Functional
I know.
medicine.
And I realize now and one of my favorite sayings really is if you weren't born with it, then it has the potential to reverse and heal. And that's what I've seen. It doesn't matter what somebody comes with, how far along it is. When you really get to the root of the root and you're able to impact that, and usually with lifestyle, sometimes people do need medication support. But if you're on a medication for longer than a couple of weeks, and sometimes, like I said, we need support, then,
Mhm.
it just means you haven't gotten to the root of the issue. So I'll stop there. That's kind of how I got into functional medicine. And it's the reason why I am still in medicine because this is truly, what I signed up for was like true healing.
Yeah, I mean, I love that story because I have a similar story of, stress. High stress causes a lot of these things, right? And it
Yep,
just seems to open up the floodgates to issues and disease popping up. And,
absolutely.
a lot of the doctors, they have their place, I feel like, in helping us because we do need a lot of medications to help support us, I think, until we find whatever that root cause would be. But I feel as though some of them are just kind of going by the script, right? They tend to be like, okay, here's the symptoms. Here's the medication that goes along with the symptoms, like you said, and then they scoot you along. And that was I ran into a similar issue multiple times and had to like come back and be like, nope, sorry, that's not gonna happen.
Yeah, and I would say too, I agree. I agree with what you're saying. And I would say even needing, so our if we look at our model, just at the traditional medicine model, it was designed literally kind of during the war and after to treat acute issues. So if somebody gets into an accident, you have a broken bone, absolutely, you
Right,
want to be in the top university or trauma center.
right.
But when it comes to chronic disease, I would go so far as to say that if we can find the right tools, then we don't actually need the medications, even for a short period of time, because sometimes being on a medication can actually delay some of the healing. And I'll give you an example. For example, like reflux. Let's this is like a prime example. Someone with acid reflux who is, they're trying to figure out what's going on with their symptoms, but they go and they get what? They get either an H2 blocker, or even worse, they get a proton pump inhibitor, and
Mhm.
then they're on that for several, it starts out a couple weeks and then they end up being on it for several years. And unfortunately, because they have actually, just because they've started that medication, they've hindered the body's ability to
Natural.
like produce, the acid, so that it's very, very difficult to come off. Same with antidepressants. So I'm not saying that all medications are, evil. I do feel like sometimes, yes, we do need support if we are not looking at the right channels. But that's why, you and I are having this discussion so that people, either when they do go to the physician, they are empowered to know what to ask for, or to know at least where to look, or to take a step beyond and know that actually you are the authority for your body. You know what's going on. And the more that we have people like you and me who have resources to show people other places to look than besides the pill, I think that's where we're going to get the most impact.
I agree. That's exactly why I have this podcast and why I want to
Hmm.
educate women on the
Yep.
alternatives of, traditional medicine, knowing that there is its place, but
Yep.
yet there are so many options that are out there, right?
Absolutely.
So,
Yep.
I mean, this is great. I know that you are no longer doing your OBGYN stuff, which saddens me because I
I'm not delivering babies anymore. I am seeing women, but yeah, what I do, honestly, it's kind of funny because even with hormones and things like that, as an OBGYN, I was supposed to be the hormone expert,
Yep.
but I knew nothing compared to the breadth and depth of knowledge about how hormones really work by looking at the functional medicine approach. And I have to tell you, Tammy, we learn this in medical school. This is like, honestly, it's biochemistry, it's systems biology. But most doctors, they take the test and they kind of forget all those pathways and systems. And then you mention it, you get out on the wards and it's make the diagnosis. We have a limited amount of time, make the diagnosis, and then here's the pill to treat it. And we kind of forget all about the systems and how the body is all working together.
Yeah, we're so interconnected. We are our own universe,
Everything.
and every
Yes.
person
Yep.
is completely unique.
Yep.
So you can't always go by the symptoms necessarily.
And the
Um,
symptoms, I think the symptoms point us to symptoms. I feel like symptoms it's the body's way of saying, pay attention or listen or something needs to change. So symptoms are very valuable. In
they
fact,
are.
the worst thing you can do is to try to numb or dampen a symptom because
Hmm.
it's only going to get louder in a different way. So I think it's important. It's one of the things that we as women, we know that we're all intuitive. We have these gut feelings. We know this, and we have to use it for ourselves, knowing that being able to kind of tap in to what our body is saying, and it does take uh, being able to tune in, to be quiet. That's hard to do when we have families, we have husbands and children and work. But these are the things that we have to do to start getting back to not only being intuitive, knowing when something's going on with your child, but knowing that your body is speaking a language and being able to listen to that and get quiet enough to kind of let it feed you the answers if you don't automatically get an answer.
Absolutely, 100%. And advocacy for yourself is so important because as caregivers, as you said, taking care of everyone else, we don't always stop to listen to our own
Hmm.
bodies. And those little pings that we hear,
Yep.
around us and our body trying to talk to us. So those symptoms, and I'm very attuned into what's happening with my body. If I eat something, I'm like, that's not right. And I need to slowly make an adjustment to try to figure out what that is. But
Hmm. And I would say, I mean, I'm kind of curious. I mean, that probably took a little bit of practice. I think sometimes we as women we think we have to know it all like right away, or
mm,
the answer doesn't come right away, or like I a lot of women just they have headaches, and
mhm,
it's so much easier to take a medication for the
right,
headache because you have things to do versus like literally sitting with the headache thinking, okay, was it something I ate? Okay, is there some stressors going on? So it
right,
does take a period of time. So I'm sure, I mean, we can make it sound like it's easy for us now,
right.
but it does take a period of reflection and practice sometimes.
It does. It
Yeah.
it's not an instantaneous like, oh yeah, I know
Hmm.
exactly what that is. It could take
Hmm.
weeks or months even
Hmm.
to figure
An
out.
investigation,
Yeah.
t keeping a journal, writing it down.
Yes.
Yeah.
Those are key ways in order to be able to figure out what the true root cause of things are
Yep.
and tracking and consistency of
Yep.
being able to do that. And then you will be able to, it'll almost come glaring out.
Yep.
It seems
I know.
like,
I
oh
know.
yeah, that's
I
why.
know.
Amazing.
Yeah,
Uh,
the body is amazing.
it is amazing. It is meant to heal, right?
Absolutely. And I think even talking about that, because I think it brings up a good point that our bodies are, first off, everything is connected. So what is happening with the headache is connected to the hormones, is connected to the sex organs, is connected to the heart and the metabolism. Like we are all, everything about us is connected. And I think sometimes when we go to, in traditional medicine, it's kind of one of my, grievances is everything is siloed. So, you go to your OBGYN to try to figure out the hormones, but then they send you to the endocrinologist to figure out, one piece of it. And then you go to the cardiologist when there needs to be that coordination of care if you're going to see a traditionalist. One of the things that we do differently as, functional medicine practitioners is looking at the person as a whole and how can we take all of these symptoms from seemingly different areas and they all have one root cause. That's the thing. It doesn't matter what the diagnosis or the symptom is. They all really tighter and teeter into, one root cause. And knowing, I usually say there's kind of like a multi-pronged approach to really getting the healing. And the first thing is, it's really taking away what's wrecking the system. That's like first and foremost. If most women are looking at just their lifestyle or their eating, toxic exposure. That's like the first place to start. I don't know how many people, I ask or they come with symptoms and I'm like, okay, well, let's go through your food diary for the day. And there's all kinds of, grains and gluten and processed foods and foods that have been sprayed with glyphosate and
Right.
there maybe and looking in places that you wouldn't think, skin and hair products,
Hmm.
a lot of those have hormone disruptors in it. So it's like removing what's wrecking the system first, because
Right.
if we get down to a baseline, the body already knows what to do and how to heal. And then, second is really the second prong. It's kind of like my three-pronged approach. The second prong is really after you remove what's wrecking the system, you're kind of giving the body a pause because if there's anything wrecking the system, you're actually activating your fight or flight response, and that puts everything in a holding pattern. And then the second prong is really adding the things that are going to help your body to do that repair. And it's quite basic, actually, if we think about what we need. And we can talk about all the diets out there and the different, oh, should I eat this and should I eat that and all of this. And we can actually test, don't guess, because some people think they're actually eating healthy stuff that might be inflammatory for a period. But it's basics. So it's like, what does our body need? We need building blocks. We need the proteins. We need amino acids. These are the building blocks. And then we need the power to make it all run. So these are like the vitamins, the minerals, the nutrients that we get from fruits and vegetables, and mostly the vegetables.
Right.
And then, there's some healthy fats and things that we need to do the insulation and kind of, and support there. But those are the basics. So anything else, I say, anything in a box or bag needs to be questioned. If you look at the ingredients and it looks like a chemistry experiment, then you might want to put it back,
Right.
staying on the outer aisles. Most people don't get nearly enough vegetables or zero when I take them through their food diary. And these are the things that kind of clean out your system, balance your hormones, and help things out. And then my third prong is actually it's going deeper. And this is, kind of really getting down to the spiritual and the energetic roots. And it's also, dealing with the stress. So kind of, going back to my story. So after, I became my own patient and I went this functional medicine route. And I figured out that my normal labs were actually not normal. They were not optimal. And I was able to reverse all my symptoms. I was on thyroid medication for a period of time. I was able to reverse everything. Weight came off, sex drive came back, all of these things. And I got those labs looking perfect, optimal. But I
Wow.
noticed at times that something was still off. And this is, it's for all the people who actually feel like they are doing all the right things or they are doing the right things as far as their lifestyle and diet and, body movement, and things still feel stuck. I challenge to look even deeper because that means there's either some stressors that are keeping things stuck, meaning, the cortisol is activated, or there could be even some like emotional trauma that's also keeping the body in fight or flight. And
Hmm.
until you really address those things, like that's where the true healing, happens and really sticks for the long term. So, yeah, but I'll stop there and see if you have any reflection. I could talk about this all day long, as you
Agreed. I
can
mean, you're
see.
preaching to the choir because those are all things that I myself had to go through in my healing journeys is, one thing would lead to another thing, but then it wasn't really until I actually got to that deep, reflection and introspection that I had to do some healing because of past traumas that, you just kind of bury those things or you think, oh, that's in the past, right? So you want to
Hmm.
forget it, but the body doesn't forget.
Nope.
It needs to be able to release in order to be able to forgive. And most of it
Absolutely.
is, us not forgiving ourselves. So,
Absolutely. And I have to say too, for people who might be listening, and probably not your audience who thinks, some of this might sound a little woo woo or kind of like a little out there, but the thing is, there's a growing body of science looking at the kind of the underlying energetics of traumas stored in the cells. There are people who've done MRI studies looking at brains of people who've had trauma that literally looks like somebody who's been through PTSD in a war. We know now that there's a field surrounding the heart that's so much bigger than, the field of the brain.
Mhm.
We've been measuring this for years in medicine. What do you think a EKG is, or, an
Right.
EMG, EEG? And then there's a growing body of evidence looking at even epigenetics, which is, a lot of people put a lot of stake into their DNA, and, oh, well, this runs in my family, so this is what, this is, I have this issue and it's never gonna, be impacted. And we know that, the DNA and the genetics is really, it's just a suggestion, but it's all of this, the traumas, the toxins, the lifestyle, the all of this other factors which really are kind of pull the trigger. So it's a good analogy I've heard. I've stolen it from someone, I'm not sure who, but it's like, genetics are kind of load up the gun, but it's the lifestyle, the emotions, all of the other things that pull the trigger. So yeah,
I have read the same thing, and my audience, I think, is totally into that with the energy
cool. Yeah.
work and knowing that there
Yeah.
is, your heart resonance versus all the energy and everything is energy. So,
Yep.
as you said, not only are our bodies connected internally, but we're also
hmm
connected externally to all the
hmm
things around us.
Yep.
So even though we have toxins that we might be putting on our body, we're also exposed to, toxic relationships and toxic,
Oof. Yep.
just toxic things that are within our environment or what we're breathing and we don't
Yep.
see. But everything has
hmm
energy, both positive and negative, and so we need to be able to figure out how to
Yep.
work with those or release those or get away.
Yes.
So
Yeah, absolutely.
yeah. So, as we talked a little bit about hormones, like I want to dig a little deeper into that for our audience because I know
hmm
some of the main pain points that women will discover, especially myself. Like when I went to my OBGYN and I was like, look, I'm having some problems with low libido, vaginal dryness, it's like not comfortable and it's super painful. And I'm still young and I want to be able to, move forward and have a loving relationship with my spouse, right?
hmm
And I said, I know that I'm menopausal, so what do I do about this? And I'm asking about hormone replacement therapy. And she was like, oh, I can just give you some vaginal cream, but you have to live with it. And I was like, I'm
Wow.
sorry, wrong answer, because
Yeah.
my husband and I will not be together much longer. So, so, what do you suggest for those types of things? And weight gain is a whole nother issue that we have to deal with.
Yeah. Yeah. Oh, I could take this from so many different angles,
I
but
know.
there's okay, a couple things to say about this. First off, what you did was correct. You recognized that that was the wrong answer. So I'm going to say number one, for anybody listening to this, before I go deeper into like, specifics about the hormones, is knowing that you know more about your body and about what's going on than a 10 to 15-minute visit ever that the doctor can, bring forth. So if you have a practitioner who's not listening to your symptoms, who is not acknowledging or feels like they're not offering any hope, then it's time to find a new practitioner,
Yes.
for sure. Having said that, so when we look at menopause, and I'm going to say even, let's take it back 10 to 15 years, because if women really look deeper, those symptoms can really start, years in advance of when a true menopause happens, which
Right.
means no menstrual cycle for a year. And those symptoms are a sign potentially of bigger issues in the body, because we know that female hormones, and that's estrogen, there's progesterone, there's testosterone as well, they're affecting other organs in a major way. They're affecting the heart, they're affecting the muscles, they're affecting the brain. So it's important to be balanced with all of those hormones. Um, Luckily, the big WHO study, that came out when I was actually in residency, that, wreaked havoc on, everybody's hormone prescriptions and really
Right.
left women in a lurch.
Yep.
The data has always been there, but luckily the public awareness around it is softening, because it never ever said that hormones were bad. It said that synthetic ones were
Right.
bad. So, Uh, a, a s- a little aside, a subset of that study actually looked at fertility patients who get massive doses of bioidentical, called bioidentical hormones, which is
Hmm.
the hormone that our bodies make, that if you put it in your body wouldn't know the difference. A subset looked at those women, no issues in the long term. So that tells us that yes, we are meant to have, balanced hormones, and that can happen throughout a lifetime. And the research shows that the earlier that we can actually be balanced, the better. Um, are there some natural, things that we can do? Absolutely. And we talked about a lot of it. So hormones, they want to be balanced, but again, you need building blocks, which we
Hmm.
talked about. You need your proteins, you need your vitamins, you need your minerals, and you need the stuff. You need to the stuff that's wrecking the flow to be removed. So
Right.
for a lot of women, again, that's toxic exposure. Um, Most of us probably, I mean, your audience is probably aware of this now to use all natural products
Right.
on your skin. It's like our biggest organ.
Yeah,
Lots
it
of
is.
stuff goes through. And for years, women have used estrogen disruptors on the skin,
For anything with
lipsticks.
perfume in it.
Yep.
Don't
Hair
do it.
products. I mean, I'm like the queen of, trying using hair products to tame my curls. So it's like,
Tell me about it.
so you have to be mindful that
Yeah.
not only is it getting into the system, but we're not doing a good job of removing it. So our bodies are meant to remove toxins. The ways that we remove that, mainly through the liver. That's where all of our hormones are processed. But if you're not eating cruciferous vegetables and leafy greens, you're not metabolizing and getting rid of all the old hormones and all of the toxins. Sweating,
Sweat.
a lot of people are going to sauna now and doing some things, but many of us are, we're not even working out. We're sedentary. We're doing these things that are not helping our bodies to release these toxins. Lots of water, things like that. So I think that short of being on a hormone prescription, and I think it's important for women to test, don't guess, and this is not in the blood, just FYI for women. So, most of our hormones literally stay in the bloodstream, on the red blood cell for about 3 seconds, and then they shoot off into the tissue. So if you are, and this was one of the mistakes I had, as an OBGYN, you would check somebody's hormones, and I
Right.
can't tell you, 99% of people's hormones, quote, quote, look normal, in the blood. But you have to test it on the tissue where it's actually working. And so that requires, getting either saliva or urine testing for women. Testosterone's pretty accurate in the blood, but the other ones are not. So I do like to test, don't guess,
Mm.
to see not only how much hormone is there, but how much has been converted into like more destructive forms of hormones, because that just signals that, you have to change the lifestyle, change the eating a bit.
Right.
There are foods, yes, that we can eat nuts and seeds and things like that that can help with producing certain hormones. But for the most part, if you get your building blocks, you're doing vegetables with a base of protein, a little bit of healthy fat in there, you're going to be golden there. It's also, I'll say, when we think about weight gain and we're thinking about sex hormones and things like that, we can't just think about estrogen and progesterone and testosterone. We also have to look at insulin
Mm.
and just our metabolic function. A lot of the brain fog. If
Yes.
if we just remove the gluten, actually, just do it for a month. A
Even
lot
do
of
it
those.
for like 3 days and you
Yes,
see the
I know.
significant difference.
That's true. Yep, that is true. So yeah, and everybody, I will say that because I don't want to make this necessarily a prescription, another prescription that, oh, okay, I have to do XYZ, because everybody is quite personalized.
Mm.
And this is where, again, it's taking back your authority for your body, figuring out what works for you, You can make things very simple when it comes to the eating. If people saw like what I ate in a daily basis, they would say, "Oh my gosh, that's so boring." But for me, food is information, and food is for energizing my body and building up my body. So I would say when it comes to food, I mean, one thing you can think about is as you're putting it in your mouth, you can literally ask yourself and ask your body, like, is this helping me to heal? Is this helping me to, or is this creating more disease? And believe me, if you're eating the candy bar, you're not going to get it's not going to tell you that this is healing your body. Most of us
Right,
know.
right. You'll get that
Um,
instant gratification because it does taste good for, the first, minute that you're actually consuming it. But then after that, your body's going to be like, what the heck did she put in
you bring up a
me?
good point. Actually, I love what you just said because I'm kind of on a mission too to kind of teach women like with this mindful eating because even though I eat that way pretty much every day, if I go out to a restaurant, like I'm going to have some tasty stuff. But usually what you'll see is I will take a bite or two and then I'm done. So if you feel like you need to have that, the snack or the sweet treat, which again, you might want to ask yourself, why do I feel like I need to give myself a reward for
Right,
something. It might signal that something else needs to change. But you bring up a good point. Like, if your body is craving something or you want something, take a bite, take one bite. And that first bite feeling, it's kind of like Starbucks when they say that, like that first sip feeling. And it's kind of like this yummy, orgasmic, like explosion on your tongue. But you'll notice after about the second or third bite, that goes away. That is a signal. That's your body saying, I'm done. And if you do that, you're less likely to create this, the inflammatory storm that your body is going to be, trying to fix later. The insulin disruption, the all the metabolic issues, and you'll actually be able to say, okay, yes, I'm enjoying life, I'm enjoying my food, but also getting in the things that are healthy for you. Another trick, I would say, if you are going to go to a restaurant and you're going to just, you can order whatever, but order like have the broccoli, just get a bowl of the broccoli, the steamed broccoli, the cruciferous vegetables first, and eat those until you're pretty much almost full, and then have what you want. So, and this isn't just, Dr. Kyia saying, yes, you got to eat your veggies because they do
okay,
all the,
mom.
even though they do all that, they clean out the liver, they do all that. But research shows if you eat your broccoli first, it mitigates damage from the rest of the meal. So these are just like little things. So again, you can create your own prescription for life. Start by, tuning in, listening to your body, doing whatever you need to do to get your body out of that fight or flight. If it's taking a walk, if it's doing some yoga, if it is, I love meditation. It's not everybody's cup of tea, but if it's not, you probably haven't found the right one yet.
Right,
Being able to like do that first and then listen to what your body wants, on a daily basis. I would say, even though it's not a prescription, you want to remove the things that are most inflammatory. That includes gluten. It includes dairy for most people, our dairy here, corn, grains. If we think about, with even with weight loss and menopausal weight loss, I always say, when it comes to gluten and grains, like what is it that we feed our farm animals to fatten them up? We want to get them fat and marbleized. We give them grains. We give them corn, oats. We give
right.
them wheat. So, it's the same. We're animals. We're animals as well. So, you can think about it that way and then test, don't guess when it comes to the hormones. And that, yes, it is. I would recommend that everyone, attempt to maintain, a hormonal balance, both for from the top to the bottom. You spoke a little bit about, I just want to address this too with the vaginal dryness. And again, these aren't symptoms that we have to tolerate as we get older. It's actually,
Mm.
again, it is a symptom. It's your body telling you that something is off. For some women, it could actually be a microbiome issue, We're starting to see, a bigger relationship between, our gut microbiome, the vaginal microbiome. If you have a disruption in your hormones, or if your body is acidic because you're not getting in the green stuff. We actually want the vagina to be acidic, but it's kind of you want the body to be nice and alkalinized, which also creates a healthy vaginal arena there. And there, yes, there are substances that are being studied now that can be used to help alleviate vaginal dryness. But ultimately, most people feel the best when the hormones are balanced and there's, healthy estrogen, progesterone, and testosterone, with all of the tissues.
Absolutely. I can agree to that because I went through that period for a while and it was horrible. Now I'm feeling way better on hormone replacement therapy. So
hmm
all
Yep.
for
And
it.
it's safe, and it is safe
Yeah.
as long as it is bioidentical, and
Yes.
that you are and that your body specifically, and I'll take a second to just I probably most of your listeners do know this, but of all of them, the one I would say that you have to be careful with the most is the estrogen, and only because it can be converted into a more destructive form of that. This is the one that really is creating growth. So if you're thinking about hormones 101, estrogen in general makes things grow. It also is great for the vaginal tone, great for the orgasms. Like we want that there. As we start to get older, and if there's toxic exposure and inflammation, it can be converted into something called estrone, which is it's a form that's a little more prone to be kind of destructive and create tumors and things like that.
Mm.
Progesterone is kind of our nice relaxing hormone. It's the hormone that makes us like calm and helps us to sleep for women.
Yep.
It also is the hormone that shrinks things, so it has to be in balance with estrogen. And then testosterone, I feel, is like the icing on the cake. We actually have more testosterone in our bodies, believe it or not, than the other hormones. Not as much as men, but comparatively. And it's our happy hormone. It's the hormone that makes life spicy and juicy and great for the libido. It's actually great for skin. So we do need a balance. And I would recommend, working with a practitioner who is testing, making sure you're not converting too much because there's things you can do to help prevent that. And yeah, the hormones should be on and popping till we leave the earth.
Right. I
Yeah.
agree. Yeah. It's a whole new way of the world for women, I think, to
hmm
be able to live a healthy, vivacious life until
Absolutely.
they're way into their older years, right?
Absolutely. And it's important because we as women, we're decision makers. We're the ones taking care of our families.
Mhm.
We're taking care of our spouses. We're doing a lot at work. So it's utterly important for us to be kind of on top of our game and healthy and vibrant and, because it helps everybody else.
Absolutely. When the woman is not happy, then the rest of the family is not
The
happy.
rest of the world.
Yes.
Yep.
Well, this was great, Dr. Kyia. I'm so glad that you were able to join us today and have this very
Oh,
in-depth and
thank you so
intimate
much.
conversation for women. So where can our listeners find you?
Yeah, so I would recommend you can come to my website, and Tammy will put the website in the show notes. It's www.drkia.com. There is my website. I'll also put a link to for Tammy's listeners for a menopause lab guide. And this is, it's one of the tools. I know Tammy has some tools as well, but it's a tool that you can at least have an idea of some of the lab tests that should be checked by your traditional doctor, as well as knowing what the optimal ranges are, not the normal ranges, so that you can actually interpret your own labs when they result. So I'll have
That
those there, and then if people want to reach out, then they can reach out through the website.
that's excellent because it is good for us to know exactly what our optimal levels should be, other than those
hmm
that say that they're normal. So
Exactly.
I greatly appreciate that. Can't wait to get a list of it. Um,
Absolutely.
so for all of our listeners, hopefully you love this episode. Please subscribe, leave us a comment on, how hormones have been working, or if you enjoyed this episode, we want to just hear back from our listeners. Please subscribe to our channel so that you know when we release all of our others on Saturday mornings. And please sign up for our email list too, where you will receive a menopause survival guide that will actually go through some of the things that we talked about with Dr. Kyia today on helping you sleep, things that you could eat, and also just some tracking tools that you can use, print off, and then scripts that you can bring to your doctor so you feel confident in advocating for yourself. So definitely subscribe to our email list and you can get that free guide as well. Sign up for any events that we have coming up on our website on limitlessladiesnetwork.com. We have several of those coming up at Oxen Oak and Salem Pines Equine Retreat, and also some coming up in the fall at the Flower Girl for our local listeners. And please be sure to follow us on Facebook, Instagram, and of course on YouTube and on LinkedIn. So thank you very much.
Thanks, everybody.